Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. Hello everyone, my name is Amy Morgan. I'm the marketing coordinator here at PDA&O. Today we're going to be covering sealants, what they are and why we always recommend them, kind of what ages those would be applied, and the application process. Also, just to start off, we want to let you know you can always ask questions in the comments and we'll get back to those as soon as we possibly can, and we'll try to answer some of those live here in the comments as well. And another thing, just real quick, we want to make sure that if you have a topic as a parent or even as a patient, if you're an older patient and you're on Facebook, that you would like for us to try to cover, or you have any questions, in regards to other things, you can send us a message here on Facebook, and we'll be happy to answer those if needed. You can also type them in the comments. Okay, so today we're going to cover sealants, kind of, again, why we do them, what ages, and the application process. So first thing I'm going to do is I'm going to read directly from the American Dental Association on what an actual sealant is, okay? So a sealant is a material applied to the chewing surfaces of your back teeth, okay? So it is a protective coating that once it's there, it doesn't allow food and plaque to get in. So it's a covering that's put on, and it's put into your molars only because of the grooves that are in your molars. So they're only applied to the back teeth because your back molars, as you can hopefully see on this video, your back molars have lots of pits and grooves in them, whereas your front teeth are more straight on, don't have as much of a chewing surface there, okay? So the other reason is because your molars are obviously, what I just said, used to chew. So since this is where you're chewing all of your food, it's going to get a lot of the damage. It's going to take in a lot of the acid. It's going to be where your plaque's going to try to accumulate, things like that. So it is going to sit on the top of the chewing surface. Obviously, when you're brushing, number one place kids do seem to brush is on the top part of their teeth. But it still doesn't mean that they're getting every single piece of that and that they're getting all into the grooves, okay? So we would recommend around age 6 and around age 12 of having sealants placed. So this is a preventive procedure, and it is simply used just to prevent future decay. So when your child turns 6, normally around then they're getting their 6-year molars. Once those 6-year molars are fully erupted into the mouth, then we would recommend that they have their sealants placed, okay? Normally this is just done during their 6-month checkup as far as our recommendation. So they come in for a cleaning. We would say, Susie has all of her 6-year molars in now. Let's set her up for a sealant appointment. We would schedule that out and have her come back. It is considered, I would say, somewhere between like a cleaning and a treatment, because it is a little bit more than a cleaning as far as like the setup and stuff like that. But it's not like an actual treatment like a filling or a crown, as in they don't need an injection or anything like that, okay? The material that they use is a flowable liquid material that is put into the grooves of the teeth, and then that is then hardened or cured or bonded to the tooth by a curing light. So it's a lot like putting nail polish on, kind of, I think. That's how I describe it. It's how a lot of girls in the office describe it to the kids, is you're going to put on the layer of polish and then you're going to dry it with a light. So it's kind of that same process. Again, we're going to do that at 6 years old. And then again, Susie comes back. She's 12, 13 years old. She's gotten her 12-year molars in. And we're going to recommend that she have sealants placed on those teeth as well. A lot of people always ask, how long do sealants last? And honestly, it just depends. Some dentists believe, a few years and then they need to be replaced. It just kind of depends. But, we feel like it all depends on the child. If your child chews a lot of ice and things like that, like those things are going to eventually over time wear those sealants down. So even between the ages of 6 and 12, you can actually have sealants that have to be replaced. On the initial treatment, most dental insurances will cover sealants. Some of them have an age limit. Like if Susie came in and she was 16 and she didn't have her 12-year molar sealed when she was younger, they may not cover the sealants because she's older. They want them done very quickly, and they're trying to encourage you to get them done on time with that coverage thing there. So, but in general, most insurances will cover them, and just some have an age limit on when they'll cut off actually covering them. But we still recommend them. Here at PDA&O, we do not let insurance dictate anything that we do in our practice. So we understand as parents, as caregivers, as grandparents, that we want to try to use all of our insurance benefits as much as we possibly can, and we strive to make sure that we are getting all that information. But there are going to be some things within our practice that are just not covered by certain insurances, especially if they've already had the treatment done once. But we promise we would not recommend something that we did not feel was important, okay? There's some statistics you can find, and we highly encourage for you to go and check out the American Academy of Pediatric Dentistry's website. They have a parent resources tab there that is phenomenal. It has everything on there. We're going to try to do more videos and more content on each specific subject that's listed there, just so you can kind of have where our office comes from for that. But they have a phenomenal resource there for parents where you can find all kinds of information. We have brochures here in the office. So we have just kind of what is the sealant, how are sealants applied. Normally, if we're recommending sealants, you should get a copy of this. We also have a brochure in Spanish and then an actual full brochure in English. And we will have these available. I will scan these in actually and see if I can't get them into the comments for you. You know, the biggest thing when I always talk to the doctors before I do these videos, and the biggest thing that both Dr. Sanders, Dr. Jerry, and Dr. Garrett, both were just like, the statistics for reducing tooth decay in children with sealants is astounding. So this actually says in this brochure, sealants on permanent molars reduce the risk of cavities by 80%. Okay, so getting those sealants done, you know, can significantly reduce the risk. So that's why we recommend it. It is considered, you know, a preventive measure. So you're not curing anything. You're just protecting that tooth from any future damage. It's not a guarantee that they wouldn't get a cavity on that tooth, but it's highly unlikely. You know, sometimes they can get them in between the teeth. Sometimes they can get them on the side of the teeth. But that chewing surface should be protected with those sealants, provided that they're staying on. What we do at every checkup, just to make sure, is that if they have had their sealants applied, then we will check their sealants. So at every 6-month checkup, we're checking to make sure their sealants are still in good tact. If they have to be replaced, you know, again, some insurances might cover that, some won't, depending on how long it's been. We may or may not have a charge for that. But again, if we're recommending that you get sealants replaced, then we're stating that child could possibly be high risk for cavities, or we're seeing something, you know, that's going on that, you know, we think could cause future decay. And so we want to make sure those teeth are protected. You know, other than that, you only seal the back molars. So it would only be your 6 and 12-year molars. We don't do the front teeth just because that's, you know, there's not a huge chewing surface there, and there's no grooves there actually for the sealant material to bond to. Okay. I don't think I have anything else to cover today. Again, if you have any questions, you can always drop them in the comments. And again, we're always looking for topics to cover. We want to make sure that we're answering your questions. And we want to thank you again for listening today. And I guess we'll see you soon. Bye. Thank you so much for watching. Make sure to subscribe and go visit us on smilesarwild.com.